So today I'm going to share information about role of social work, working with glioblastoma patients, and particularly similar to what Dr. Sharma was saying about palliative care, is that our glioblastoma patients come into our clinic, and as a team, we meet them where they are, meaning that there are so many psychosocial things going on with the patients that we really, one support system is not going to be for everyone. So we want to really meet our patients where we are. And today I'm going to focus on our patients who are making decisions about returning to work and what their options are. Dr. Bond, just press to go forward.
Yeah, just arrow.
Arrow. Okay. There we go. So again, we're going to demonstrate the key roles for social work as well as communication, our patients and their family members, communicating with employers regarding their leave benefits. So one of the things I do want to share, just a broad overview of what an oncology social worker does. So in our IB center, we can help patients with obtaining their advanced care directives and their living wills, durable powers of attorney, the portable orders for life-sustaining treatment, that POLST. One of the things that I'm really proud about in our clinic that we've been doing lately is encouraging and getting permission from our patients to create a proxy for their MyChart account. What that does is that improves communication, it improves opportunities for us to communicate with the families about transportation or really nip in the bud any issues that are coming up psychosocially for that patient. But I'm really proud of our group that we have been looking at that as an option with our patients. We do, as Dr. Bonnet mentioned, we do have a support group that is offered twice per month. It's for not only the patient, but also the caregiver. So we have on average between 5 to 10, I would say, patients and their caregivers per month. It's done virtually monthly, and we have great participation. We learn a lot. It is a true support group where folks are sharing information about resources and just coming to get support from other patients who know exactly what they're going through. One of the things that I do as a social worker is really provide that emotional support for our patients and their loved ones, and that's just by holding space for them. I am part of the team. I am the one that has the capacity to provide active listening, do some solutions-focused problem solving with the patients, and then offer community resources and support. We also have offered in the past peer support resources where we connect patients to other patients who are similar in age, who have similar diagnoses, and that's been very helpful. One of the main things that we see in patients with glioblastoma that's been mentioned before is the financial toxicity. And patients have to decide if they can go to work, if they're the caregiver, do they have to quit work? Do they have to access their leave benefits to care for the patient, getting them transportation to and from radiation? So a lot of things are happening with the patients and their families regarding finances and insurance. Also, we're looking at just a variety of resources that we can provide that are community-based for the patient and their family. That might include home health, chore services, in-home care, and then, of course, we definitely interface and collaborate with palliative care, hospice services, and then we have about a handful, maybe, of patients each year that request the Medical Aid in Dying or Death with Dignity Act, and then as a team, we collaborate on paperwork and supporting that patient with that decision. One of the main tools that social workers, oncology social workers use to target resources for that patient is the distress screen. This is kind of my made-up model here of a distress screen. But the nice thing is that this distress screen comes in 71 languages. So regardless of the primary language of our patient, we're able to meet their needs by providing a distress screen in their language that they can understand, that they can let us know what their needs are. They focus on physical concerns, emotional concerns, social concerns, spiritual or religious concerns. But I will tell you, of the distress screens that come my way, it's the practical concerns that the patients most often identify. And that includes taking care of themselves, others, work, school, housing, finances, insurance, and transportation. So that really is the majority, I would say, of the patient care needs that are identified. So talking about our patients and the financial toxicity and the need to work, I recently attended a wonderful workshop by Cancer and Careers that really identified patients wanted to know, should I tell my employer that I have this diagnosis, that I have cancer? And what I was pleased to hear, what I was surprised to hear actually, was that Cancer and Careers at that webinar identified, as Dr. Sharma did, that that's a personal decision for the patient, that that patient would need to determine their relationship maybe with their manager, the support that they think they could get from work. But the main topic is financial. And even beyond that, it's healthcare, maintaining their healthcare benefit. So again, that patient, and when I meet with them, we talk about what is the goal and the needs of the patient and the family. What I do recommend to all patients that come to see me regarding their leave benefits is that, if able, to request to take a care partner with them when they meet with their human resources representative, whether that's a spouse, a friend, a union representative, somebody who can take notes. As we know, our folks who have glioblastoma are going through treatment, can have some cognitive decline, can have some issues with memory. So we really want to make sure that any information they're getting from their human resources regarding their leave benefits, someone else is available to help them with note-taking. And one of the other things that Cancer and Careers said that I found very important and that I share with all my patients is, do you know how to access your employee handbook to look at the leave benefits? Do you have a physical copy? When you first got hired, did they hand you a physical copy? Is there a PDF? Wherever that copy of that leave benefit or that handbook is, I encourage patients to take a look at that and really understand what their benefits are. And then probably most importantly of all is to get organized. If the patient is not able to organize themselves, have, again, a care partner who can help them stay organized with a file, a folder, something that keeps all of their records together. Because in the long run, it's going to be more beneficial for them to understand their benefits. So going over the types of leave that folks are entitled to, we'll go over this, I'm going to give just kind of a broad overview. And again, any patients, families, I really request that they talk to their human resources or their leave benefits representative to have an understanding what they are entitled to, what benefits they're eligible for. So for PTO, I wanted to emphasize, in Washington State, we have the Washington Paid Family Medical Leave, which is short-term disability. Sometimes folks were under the understanding that they had to spend down their PTO in order to be eligible for Washington Paid Family Medical Leave. The Washington law states that folks do not need to exhaust their PTO before using paid family medical leave. Sometimes patients have been very lucky with their having a shared leave program through their employer. And what that means is that maybe they've exhausted their leave, they haven't worked enough hours to get onto Washington Paid Family Medical Leave. FMLA is an unpaid service or is an unpaid benefit, so they need something to kind of get them through those first couple of months. So what I ask them to do is check with their company to see if they have a shared leave policy. And oftentimes, folks will get leave at the very minimum of what they need to maintain their healthcare benefit. So other employees in the company are donating, a couple of hours per month, and to combine, that helps that patient maintain their healthcare benefit, because that is one of the most important things they say that they want to maintain. TMZ costs money, radiation costs money, transportation to and from radiation costs money. So they want to go ahead and maintain their healthcare benefit as much as they can. Another option would be taking your safe sick or your extended illness bank. One of the things I learned just this year, I've been, like Dr. Bonham said, I've been with the Ivy Center for 5 years, but just this past year, I learned that sometimes caregivers can access their extended illness bank. So we had a woman who worked for a large company ask if I could write a letter on her behalf or fill out a form. And initially I was kind of like, no, that's not possible. And she said, no, it is. I can access my own extended illness bank to care for a loved one. And there were certain criteria that had to be met. And I think having a terminal diagnosis was one of them. Her spouse did have glioblastoma, so she was able to access her extra PTO, her extra leave, in order to care for her husband while also getting a paycheck. So that was helpful to that family. The most important, I think, thing that's happened in Washington State, or there's a couple of other states that have this, is the Washington Paid Family Medical Leave, or that paid medical leave option, also known as short-term disability. So what this does is that it offers you up to 12 weeks of paid leave that could be used either intermittently or continuously. The patient or the family decides how much they want to use. However, to be eligible, you have to have worked 820 hours out of the last 4 of the 5 quarters. But guess what? You don't have to have been currently working in order to access that benefit. As long as, if you're not employed currently, and we recently experienced this with a family member with their daughter who was like in her 30s, and she said, no, I haven't been working for the last couple of months. But she had worked over 820 hours in the last 4 out of the 5 months. So she was able to access those funds that she paid into in order to have paid leave. So I always want to emphasize that with families and patients, is that you don't have to be currently working in order to access that Washington Paid Family Medical Leave. And then again, it's medical leave for the patient or family leave for the caregiver. We fill out the paperwork. It takes us just a few minutes to fill it out. We send it to the patient via MyChart. They upload it into their SAW account, and they get their leave paid. So FMLA is the federal program that just is job guarantee. It's gonna protect your job. It's unpaid. So sometimes families use FMLA with their PTO. They use FMLA with their extended illness bank. So they cobble the benefits together. What I want to really point out is that Washington Paid Family Medical Leave and FMLA have 2 different criteria of what a family is. The Washington Family Medical Leave provides a broader range of who you can take leave off if you're going to be a caretaker. There is a much broader category. That can include a sibling. It can include a parent, step-parent, somebody who would be expect you to care for them, maybe a roommate. So Washington Paid Family Medical Leave does have that broader definition, where the FMLA, you take leave off to care for a parent, a child, or a spouse. So we always want to make sure that families understand that those criteria. One of the things that I wanted to mention as well about leave is that sometimes folks, when they decide, I do need to work, I need to go back to work, I'm feeling much better, I could probably work a reduced schedule. So through the American with Disabilities Act, there is something called the reasonable accommodations. And we've completed paperwork on patients' behalf who say, I think if I went to work and we had a lady who worked in a grocery store, she just needed a stool to sit on. She got fatigued. She said, if I just had a little stool to sit on, I'd be okay. We wrote accommodations for her to have a stool to sit down. Another individual identified that she got fatigued in the afternoon. We wrote a reasonable accommodations request for her to have a nap in the afternoon or be able to take more frequent breaks. So things as small as that benefit the patient and support them getting back to work, we're going to write letters on their behalf. We're going to really champion folks getting back to work if and when they can. So the other opportunity that folks have for leave is a long-term disability insurance. And people have to pay into this. You have to have already purchased a policy, usually through your employer. And it pays a percentage of the employer's salary, usually between 50 and 70% of a person's salary. And the good thing about a long-term disability policy, when you enroll, when you first are hired or you enroll through your employer, they can't dismiss pre-existing conditions. However, if you have a diagnosis, say you get a diagnosis of glioblastoma, and then you go and try to purchase a long-term care policy, you most likely would be declined, or you wouldn't be able to purchase that. But again, something to consider with the other family members. You get a new job, really taking into account going ahead and purchasing that long-term disability insurance that's offered through your employer. And finally, the one that we talk about most for our patients with glioblastoma is Social Security disability. So one of the things about glioblastoma and folks who have oligodendrogliomas and astrocytomas are that criteria of a cancer diagnosis falls under compassionate allowances criteria eligibility through Social Security disability. And what that means is the application is flagged so that it's reviewed on a much faster than, say, somebody who does not have this diagnosis. So I always share that with patients. There's nothing that they do to flag their own record. Just that diagnosis alone will have eyes on it much quicker than if they did not have that diagnosis. For Social Security disability, there's two ways they're going to determine eligibility. They're going to determine it through a work test, meaning have you worked enough hours toward it? Are you currently working? When was the last time you worked? And then they also want to look at the duration of work, showing that you've paid enough into Social Security. They have a great little booklet with a chart that shows you your age and then how many years you would have to pay into Social Security in order to be eligible. So I have books like that in my office that I share with patients on a weekly basis. One of the things about Social Security disability, once you have been receiving benefits for 2 years, you automatically qualify for Medicare. So some of our patients have to weigh out if they get Social Security disability, if they are not still working for their company, if they cannot work, there's going to be a 2-year period where they're not going to have health insurance, or they're going to have to go out on an exchange and purchase health insurance. So again, these extra financial decisions, insurance decisions that folks didn't even anticipate they were going to have to make, weigh heavy on our patients. So we really take a look at really I talk to our patients about dovetailing their benefits, really understanding what benefits you're entitled to so that you can maximize. You're going from short-term disability to long-term disability to Social Security disability. Maybe you're using your PTO, then you're going to take your short-term disability. So whatever it is that's going to maximize your benefits, we really encourage patients to work with their HR representative to talk about what they can do to extend those benefits as long as possible. Social Security does have work incentives if folks are able to return to work. We have younger patients who come through our clinic with GBM who have been on and off Social Security disability 3 times. So they come off Social Security disability. They work with Social Security all the time, though they never do this independently. But I always let folks know that you can work while receiving Social Security. What they're going to look at, again, you're going to work with Social Security representative on this. What they look at is how much it's not the number of hours you can work, but how much you can earn so that you don't lose your Social Security benefit. So this is something that most folks who have a strong identity with their work, they enjoy their work, they want to go back to work, we encourage them to talk to Social Security about figuring out a way to do that. We have these little SSDI starter kits that help people get organized. I have it on a PDF. You can get it from Social Security. But what it does is it helps people gather their information in order to submit the strongest application possible. Additionally, folks who, again, we're working with people who might have some issues with manipulation, with memory, with communication. If they gather the information. They can call Social Security and make a telephone appointment. It's about a 60 to 90-minute appointment, and Social Security will input the data for you, and your application is done at the end of that phone call. And folks are often overwhelmed about, how am I going to get my medical record? How does that happen? And so what we let folks know is that Social Security will reach out to the clinics that you've identified as the providers, and they will seek medical records directly from those providers. The burden is not on the patient to identify to get their medical records to Social Security. And I share with patients, they're able to obtain their medical data through their MyChart. So it's something that can seem overwhelming at times, but again, with some help and a little bit of organization, the process can go much more smoothly. And then finally, here's some resources for our patients that I often share about Washington Paid Family Medical Leave, FMLA, SSDI. ALSEP is an organization that helps folks who maybe have gotten a denial from Social Security disability, or they have questions. They're a good organization. Another good organization for folks who are working or want to work or want to understand their rights and benefits, Cancer and Careers. And then finally, another organization that I absolutely love and refer folks to is called Triage Cancer, and their legal and resources for legal information and employment. Oftentimes they have free materials, webinars, whatever we can do to provide information to our patient. Again, meeting them where they are so that we can target we can target resources to them to help decrease their psychosocial distress given this diagnosis. Any questions? That was a lot of information in a short period of time.
Brenda, thank you.
You're welcome.
That was a whirlwind. I'm curious if you could impart one pearl of wisdom to physicians and APCs, whether they be surgeons or oncologists, for patients who may not have access to resources like a social worker within the brain tumor program. What is the first sort of most important step from your perspective when somebody gets one of these diagnoses in terms of trying to create some financial stability and security for the family?
Sure. So one of the things I would look at would be having the families get on the same page about what their goals are for their finances, for healthcare. And then secondly, I would have the individual, the patient, if they are currently working, set up an appointment with a human resources representative to discuss their benefits and to have a good understanding, and to take a care partner with them so that nothing falls between the cracks. We had a gentleman who worked for Boeing, and he came to me with the most beautiful matrix that Boeing had given him about his benefits, when paperwork was due, if he was approved or denied. And so I wish I had made a little graphic like that. But I think the most important thing, Dr. Levesque, that I would share would be talking to human resources and understanding benefits. And then when paperwork is due for that particular benefit, leave benefit, so that they're giving if it's your office, like if it's neurosurgery and your staff is doing the paperwork, making sure that they're giving that clinic time to complete the paperwork so that their benefits don't fall by the wayside because they didn't get the paperwork to us in time. So I think that's the main thing, just understanding what benefits you have and then how to access them. Yeah.
Thank you. And related to that, what is your message, or what should our message be when patients or their families express concerns about talking to HR and disclosing a potentially terminal diagnosis? Because there's often fear around disclosing that diagnosis.
Yes. What the webinar I just attended for Cancer and Careers talked about is taking a temperature of the environment at work. Are you able to have flexibility in, for an example, if somebody was getting radiation, and could they talk to their employer about working in the mornings and then taking time off in the afternoons to get their radiation, and really minimizing the amount of time they're away. But I think we leave that up to the patient to kind of determine what the work environment looks like, what their needs are, what their goals are. And even though it is difficult to, people said they don't want to feel pitied, they don't want to, there's fear that they might be fired. What we say is kind of, if you really need to access your benefits, you probably do need to express your diagnosis or, discuss your diagnosis so that you can maximize benefits. And sometimes you just have to kind of weigh one thing against the other. But maybe they also recommended if there was somebody else in the underemployment that maybe expressed the same thing or had the same diagnosis or a similar, chronic condition, to talk to a coworker about what their experience was and what they would recommend. But it really would be up to that individual to determine their goals and how they're to work with their human resources. Yeah. Thank you guys very much. Thank you.